In our previous use case share partial, the servicing organization was constrained by 42 CFR Part 2. In this example, our test patient is a veteran, and the organization is the Department of Veterans Affairs, which is obligated to enforce Title 38, Section 7332 protections. This demonstration will focus on clinical and organizational aspects of data segmentation for privacy, such as clinical fact administration, which allows us to loosely couple privacy concepts to clinical observations such as diagnoses, medications, etc. The security labeling service, allowing organizations to control how data is tagged and what metadata will be associated with it, based on the patient's consent, organizational policy, and jurisdictional restrictions. And lastly, we'll look at what effects our new clinical facts and organizational policies have on rules generation and document transformation. In clinical fact administration, we are accessing an authoritative, federally developed, and freely available terminology service, the Unified Medical Language System, provided by the U.S. National Library of Medicine and National Institutes of Health. As a result of Phase 1 pilot demonstrations, it should be noted that the coupling of purpose of use and implied confidentiality to the clinical fact will be moved under the organizational policy in Phase 2. Additionally, there is a movement to utilize SNOMED CT concepts as opposed to codes related to specific findings. Because our demonstration is focusing on the Department of Veterans Affairs and their Title 38 Section 7332 requirements, we will be adding clinical facts to the repository for diagnoses and medications related to sickle cell anemia. Please note that facts related to substance abuse, HIV, and mental health related issues were added in previous demonstrations. The security labeling service blends known clinical facts with organizational policy to produce a suite of rules that can be processed by a rules engine. We will now connect to the Department of Veterans Affairs Security Labeling Service. At this point, we have already created organizational policy for data segmentation when the entry is related to sickle cell anemia. Attributes such as purpose of use, the entry's sensitivity, the patient's privacy concern, the action requested by the patient, privacy law, actions organizations are obligated to perform, document handling, and obligations related to the recipient. These attributes all play a role during rule generation. We will now complete the Department of Veterans Affairs requirements by creating data segmentation policies for substance abuse, HIV, and mental health related treatments. Let's recap. The veteran has added an additional constraint to their consent directive to mask any entries related to sickle cell anemia. We have also updated the clinical fact repository and created data segmentation policies specific to the Department of Veterans Affairs. Let's now test the effects of these changes to rule generation and document transformation. First, let's generate an NHIN direct access control decision, as we are interested in obtaining the obligations from the patient consent as well as the servicing organization. The obligations returned from the access control system contain patient restrictions to redact substance abuse and mental health related issues and to mask HIV and sickle cell anemia. The organization is also constrained by Title 38, Section 7332, and requires the enforcement of the no redisclosure refrain policy. Using the Security Labeling Service test interface, we will now generate our rules based on these obligations. Let's look at some of the rules that were generated that might affect transformation of our test patient's clinical summary. An example of a rule to redact substance abuse. The next example is a rule to redact an antidepressant for the treatment of a mental health related issue. Note that this rule identifies 42 CFR Part 2 as the constraining U.S. privacy law. Next, a rule for the masking of acute HIV. And our final example for the masking of sickle cell anemia. As previously demonstrated, when these rules and the patient's decomposed C32 are sent to the rules engine, a series of transformation directives are generated. The following 3 rules fired and will be acted on by the document processor. This ends this demonstration of data segmentation for privacy, Title 38, Section 7332, Share Partial.